Hi, I'm Dr. J. Pepose, and I'd like to talk with you about what's new in cataract surgery and what your experience will be. Years ago, cataract surgery was very different than today because patients were hospitalized and were restricted from moving with sandbags around their head, and incisions were made that were very large with sutures that needed to be removed. Today's cataract surgery is a 20-minute outpatient procedure which is sutureless, is quick, recovery is fast, and so it's dramatically different than what we had in the past. But this is an important decision to make in terms of what lens to implant, because that's what's replacing the cloudy lens, which is what is the cataract. In the past, we only had single focus lenses, sort of like the old Brownie camera, and we had no treatment for other eye conditions like astigmatism. But now, in a sense, this is your once-in-a-lifetime opportunity to dramatically change your eyesight, because the lens implant will dictate the way light is bent and what you will see. And so now we have the opportunity to see not just distance, but to see distance, intermediate, and near, and also in the same eye. So we have many options to consider. And as you go through the process of measurement, and we talk with you and find out what your goals are, do you spend time on a computer, do you use a cell phone, do you do a lot of reading, what's the most important thing for you to accomplish here, we'll be able to customize this decision with you. And so we're going to walk with you on this journey of refractive cataract surgery. Cataract lenses come in different classifications. They come single focus, with and without astigmatism correction. We have other ways to correct astigmatism as well. Astigmatism means that the front of the eye is shaped kind of like a football rather than round. We also have depth of focus lenses. Those are lenses that give a continuum of vision all the way from arm's length out, and it's more similar to the more youthful eye. And then finally, we have multifocal lenses, which basically create a near focal point and a distance focal point in the same eye. And then some patients in the past have worn contact lenses with what we call monovision, one eye set for near, one eye set for far. So those are all options that we're going to discuss with you today in the consultation. Now, when I talk about the journey of cataract surgery, I'm talking about 4 potential steps in a journey. The first step is taking out the clouded lens, which is what's been changing in your eye, and substituting an artificial lens. That lens is made out of acrylic, and it will last the rest of your life. Now, when we take out the cataract, it's like a grape. It has a peel. The peel we refer to as the capsule, and part of the capsule will be left behind in order to hold the artificial lens. Now, in about 1 out of 4 people, over months, sometimes years, the capsule can cloud. Some people refer to that as a secondary cataract, but it really just means clouding of the capsule. And if we see that, we'll dilate you 1 month after surgery to look for that. We will use a laser beam to open the capsule. And that's a 60-second outpatient procedure, which would be covered by insurance if that would be needed. So that could be the second step of the journey. The third step, which only occurs in about 1 in 20 people, is fine-tuning the power of the lens by using lasers applied to the cornea, either through LASIK or LASEK or some form of laser vision correction. And we can do that with exquisite accuracy because the lasers are programmable in very, very small steps. Lens implants are made in half diopter steps. Diopter is a measurement, and it'd be like going to the store and buying a dress or a suit. In the LASIK shop, there'd be 1,000 sizes, and yet in the cataract shop, they might be 100 sizes. So we're going to get very close, sort of like in golf, we're going to get on the green, but we can't hit a hole in one every time because they don't make lenses in that fine step. So we do have the option of using a laser, which is sort of our way of going to the tailor to fine-tune this at the end. And that might require waiting a little bit of time for you to allow the eye to fully heal, and then we'll apply laser in some form to fine tune. Again, that's only necessary in about 1 in 20 people, but that could be the third step of this journey. And then the fourth step is just giving yourself some time for your brain to kind of readjust to a new type of vision. Just like you have to readjust when you get a new pair of glasses. It takes sometimes a week or two for the glasses to seem normal and right. And so there is some neurological adaptation to these new types of lenses. So that, in a nutshell, is the option of refractive cataract surgery. In other words, a new way of seeing that makes you much less dependent on glasses or contact lenses. Now, some of these options are what we call mixed or hybrid procedures in terms of insurance may cover parts of this. Some of this may be out-of-pocket expenses if you elect to have some of these services done, because not all the insurance companies will cover upgrading to these new types of lenses. And we try to make this as affordable as possible. We do offer two forms of reimbursement, one is called Care Credit, and the other is Alpheon. And basically, these are plans that we offer. They give you zero interest financing over a substantial period of time, so that these payments can be made over time, and there's no interest payment for you. So many people do take advantage of this to make it more affordable. So today you're going to have a lot of measurements done. Ask as many questions as you have, both to the technical staff and to the doctors as we see you today. And we're going to do everything we can to customize this and make this a great experience for you, so you can enjoy the gift of sight. And the great aspect of this is these lenses don't degrade. This gift of sight will be there for the rest of your lives.